Breathing disorders such as asthma, bronchitis, and emphysema are a major bane of the modern human being. Many suffering from such chronic obstructive breathing disorders find relief in yoga. Yoga offers practices that can strengthen the entire breathing mechanism. Our lower lungs, middle lungs, and the upper lungs can be rejuvenated and invigorated with different practices. To perform the first of the practices for breathing disorders, the Ashtar, the camel posture, take up a nice high heel sitting Vajrasana. In the Vajrasana, we are having an erect spine that helps us to breathe better. Slowly come up onto your knees and bend back, catching your heels with the respective hand. Push your back forward so that you have a nice arch in the back. That type of arch helps the breathing in the lower chest region. Make sure you are breathing in this posture. When you breathe, the air is forced into the lower chest region, expanding the lower rib cage. Now slowly release, coming back onto your knees, and slowly and consciously sit back in the Vajrasana. Close your eyes and just a few rounds of deep breathing, breathing in and breathing out. Concentrate on this lower chest region, the Adama area of the lungs, where the Ushtrasana helps force the air, energizing and healing this whole lower lung region. For the middle lung region, we can do an asana known as the Shasha Asana, the rabbit posture. Bring your hands in front of you, placing your wrists and knees together. Lift your head up and stretch your back as much as possible as if you are a rabbit with your head up. Concentrating on the middle chest region, start to breathe in and breathe out. Breathe in, breathe out. Slowly relax your head back and come back to the sitting in the Vajrasana. Just relax with some deep breathing, concentrating on the middle area of your lungs, the Madhyama area. This area, a vital area with the heart, and definitely all the blood vessels and the heart is there, gets energized when this simple practice is done. The next of the practices, which will be for the upper chest region and also helping drainage of congestion from the lungs, is the Balasana, the baby posture. To perform this posture, slowly come forward until you are in the Chatushpada, the four-footed posture. Bend your elbows until your chest is touching the floor and turn your head to one side. Here you are resting just like a baby. This posture promotes the drainage of congestion out of different parts of the lungs and promotes the breathing in this upper chest region, which is known as the Adhyama Pranayama. This type of practice, which is done naturally by the babies whenever they have congestion, is very vital and very simple that all those suffering breathing disorders can incorporate into their day-to-day life. Slowly coming back into the Chatushpada and coming back to the Vajrasana, sitting for a few seconds in the Vajrasana, concentrating on breathing in and out of the upper section. When we are doing the Balasana, we can also do it with the head to the opposite direction, thus helping promote the drainage in both sections of the lungs. Coming to a practice that can help us improve low, mid and upper breathing together, the Mahat Yoga Pranayama, we will perform a practice known as the Sharaba Asana. To do this practice, come on to all fours. From the Chatushpadasana, slowly breathe in, lifting your leg and your head at the same time. As you breathe out, slowly bring your leg and your head back down to the ground. Breathe in, lifting your head and leg simultaneously. Breathe out, slowly coming back down, back to the position, and bring your head down. Perform the same on the left side, breathing in, and breathe out, bringing your leg down and your head back down. Breathe in, lifting up. Breathe out, coming back down, back to the position. Come back to the Vajrasana. And a couple of rounds of deep breathing, breathing into the low, mid and upper sections of your lungs. Let the air consciously enter all the sections of your lungs, energizing and invigorating all these sections, making up your entire lungs. How do you feel after doing these practices?
I feel much more relaxed and breathing more freely.
That's really nice, because one of the major problems that people have when they have breathing disorders is that they complain of a sense of tightness. And they get not only the tightness in the chest, but they get uptight as well. And these practices, which are so simple that everybody can do them, help us to relax physically, emotionally, mentally.